The member for Kew.
I rise to speak on the Mental Health and Wellbeing Bill 2025. Acting Speaker, this bill makes further amendments to the Mental Health and Wellbeing Act 2022 and related legislation. It represents the second round of changes since the Act came into force, and its main purpose is to tidy up the system's administrative and operational settings. The bill does four main things. First, it abolishes the Forensic Leave Panel and transfers its functions to the Mental Health Tribunal. And this change responds to workload and resourcing pressures within the existing panel and is intended to streamline decision-making about leave for forensic patients. Second, introduces new information sharing arrangements to enable the rollout of Victoria's new electronic mental health information system. This system is meant to improve coordination between hospitals, ambulance services and community providers. Third, it clarifies provisions about support decision-making to ensure that when decisions are deferred to a nominated support person, it is the views of the patient, not the support person, that guide the outcome. And fourth, it requires a psychologist to examine a person following the use of restrictive practices. Acting Speaker, these are technical amendments, but as with any legislation in this space, the real question is not whether the system looks better on paper, but whether it works for people when they most need help. Acting Speaker, that brings me to a family in my electorate who I have come to know well, Tamara and Richard Wraith. Tamara and Richard tragically lost their daughter Amber to suicide in April 2022. Amber was only 19 years old. She was bright, creative, and she was deeply loved. But tragically, Amber was diagnosed with a complex mental health illness in 2019, including severe depression and anxiety, with her psychiatric condition deteriorating over the years that followed. Despite seeking help, Victoria's health system failed Amber. From the outset, I want to express my deep admiration for Tamara and Richard and their family. Having lost their daughter and the unimaginable grief that they will carry for the rest of their lives, Tamara and Richard are determined to focus their energy and Amber's legacy on improving our health system so that other young people and their families never find themselves in the same situation. Acting Speaker, I have met with Tamara and Richard several times. I've listened as they have gone through the details of their daughter's treatment and the endless list of missed opportunities to keep her safe. I am broken by their grief, but I am so deeply moved by their strength and determination to ensure Amber's legacy is one of reform to our mental health system. Since Amber's death, they have dedicated themselves to understanding how and why the system failed. Their advocacy has prompted a root cause analysis at St Vincent's Hospital, a review at Headspace Hawthorn, and eventually a coronial inquest. What is clear is that Amber had done everything right. Her parents had done everything right. But despite their tireless efforts to get the help she needed, the system failed her. When the coroner's findings were handed down earlier this year, they confirmed what the family already knew. Amber was discharged from emergency care without a proper safety plan. Clinicians failed to gather information from her family or her treating doctors. And there were serious gaps in communication between services. The coroner acknowledged these deficiencies, but made no clear findings about how or why they were allowed to happen. That lack of accountability has left the Wraith family without real answers, and the system without clear direction. Acting Speaker, it's not good enough. In response to Amber's death, Tamara and Richard established Amber's White Light, a foundation dedicated to improving care for young people with complex mental health issues. They are working with Black Dog Institute to see their suicide prevention guidelines for emergency departments implemented in emergency departments right across the state. Clear, evidence-based protocols for identifying suicide risk and managing crisis presentations. Through Amber's White Light, they have funded a research project at the Monash University Her Centre to develop a world-first objective biologically based diagnostic toolkit, including blood tests for key biomarkers, rapid eye movement test, and a structured research-derived questionnaire. They are doing this work because despite years of reviews and a royal commission, the system is still not delivering. The Royal Commission was meant to give us a roadmap. It spoke of a system built on compassion, continuity and lived experience. But those recommendations must be translated into clinical practice. And that means mandatory, evidence-based suicide risk assessment and safety planning in every emergency department. Consistent diagnostic tools to identify complex conditions and psychosis early. Integrated data and communication across hospitals, GPs and community services. And genuine inclusion of carers and families in every stage of the treatment. Acting Speaker, Amber's story lays bare the consequences of a system that remains fragmented and under-resourced. It is now more than 4 years since the Royal Commission into Victoria's mental health system delivered its report. That report was meant to mark a turning point, a commitment to rebuild the system from the ground up. Instead, progress has stalled. Instead, again, with the bill before us today, we are playing around the edges. The shift to mental health-led crisis response has been reversed. We are back to a police-led model, even though the Royal Commission made it clear that this approach can be traumatic for people in crisis. The government talks about reform, but has failed to deliver the workforce funding, the services needed to make it real. Promised mental health and wellbeing have been cut back. Budgets have been trimmed, clinicians are stretched beyond capacity, and access to care is now worse than it was before the Royal Commission began. This bill makes administrative changes, but it does nothing to fix the fundamental problems, the lack of accountability, the lack of follow-through and the lack of investment in frontline services and care. Acting Speaker, Tamara and Richard should never have had to become investigators in their own daughter's death. They should never have had to write to ministers to read clinical notes just to find out what went wrong. But through Amber's white light, they have turned that pain into purpose. Acting Speaker, we often talk in this place about infrastructure, about roads and bridges and rail. But the infrastructure that saves lives is not made of steel or concrete. It is the strength of a system that meets people with empathy and coordinates care. That does not leave families to navigate crises alone. When a young woman like Amber can present to a hospital in clear distress, leave without a safety plan and die days later, it shows that a system is not just under strain, it is broken. We owe it to Amber and to every young person who has been failed by this system to do more than pass the technical amendments before us today. We owe them real reform, and that means implementing the Royal Commission's recommendations in full. Not half measures, not delays, not cuts dressed up as efficiency. It means learning the hard lessons from Amber's story, where the system failed her and how it can be fixed so that young people right across this state are saved into the future. Acting Speaker, this government has had 4 years to act, and Victorians are still waiting. We owe it to Amber, and we owe it to all those who have lost their lives to finish the job before us. And Acting Speaker, can I just note, when I spent this speech to Richard and Tamara for their review today to ensure they were comfortable about speaking to Amber's story, I just want to read a comment that her mother sent back. She says, "I can sense you have tried to imagine the unimaginable and walk in our shoes as parents and with me as a mother. To Tam, I cannot imagine the pain you have gone through. I cannot imagine, to be honest, how you get up out of bed every single day and fight a system to ensure that people and young women like Amber never have to face a system that does not meet the needs of those with serious mental illnesses. As a state, as a government, as a parliament, we should do so much better to ensure we put the services around the people who need it most, so that when they present to an emergency, in distress, in need, the system meets them with the clinical tools to ensure that they are safe and the consequences that we saw with Amber never happen again."